in the tobacco control environment, we have tobacco-free schools. And we know that tobacco users start as teenagers. The policies and programs that children are exposed to in school are an important part of communities' overall approach to tobacco control. So that's one of the things that we have done well and that we need to continue to do well, is to model the behavior for our children. And that includes tobacco-free schools. Awareness and counter-marketing campaigns vary throughout the states, but we know that that is huge to counter-market what the industry is teaching and marketing to our children and even our adults. Access to treatment. Access to treatment is another important piece in tobacco control policies. Rural tobacco users will face a number of challenges that may limit their ability to quit when they're ready. Healthcare providers can play a vital role in encouraging and assisting quit attempts by their patients who use tobacco products. But geographical isolation means they could probably travel up to long distances to get to healthcare facilities, or travel long distances to get to any type of healthcare services, including ways to quit. We have some statistics on rural and frontier communities that we're trying to serve medically underserved areas. Bill May can talk about this later, but there's lots of stories and lots of statistics that talk about that issue, access to care in rural America. We could go on and on about social attitudes and personal beliefs, but let's just get to solutions and successes. I just wanted to close up with solutions. We do know that policy affects behavior change. That's just kind of Public Health 101. In public health, we know that we have to change attitudes, beliefs, and increase knowledge. Our tobacco control policies do ask for cessation treatment to be available to every American, either through quit lines or actually cessation centers. We know that providing smoke-free environments will reduce exposure to secondhand smoke. We know that tobacco education and prevention is the key from very early childhood age. We know that higher price strategies on tobacco products will help encourage adults to quit and help youth to never start. So we appreciate the National Office and their report with all the statistics that show that we need to focus on rural America just as much as those in urban and suburban areas. That we need to cut tobacco's rural roots. We need to continue fighting our fight in tobacco prevention and education in tobacco control world. But ultimately, we need to partner with associations such as the National Rural Health Association and other health systems to join this in a collaborative approach to educate and bring about awareness to this major disparity in tobacco use. And now I'll introduce Brock Slabaugh with the National Rural Health Association, who's Senior Vice President of Member Services for their association.